Before the break, we were talking about the pressures on our healthcare system, specifically in our hospitals, and one of those pressures stems from ALC patients, or alternate level of care. These are patients who don't need medical help anymore, but stay in the hospitals occupying beds because they have nowhere to go, in some cases for months to years. Dr. Sheikh, give us a sense of the sort of scope of this problem. What are you seeing in your hospitals?
This is a huge challenge, and it's a challenge that precedes the pandemic. You know, when you have patients getting the wrong care in the wrong place, like these ALC patients staying in hospital, the downstream effects are enormous. So it means that there's less beds on the floor for acutely ill medicine patients. It means that those medicine patients end up staying in the emergency department. And in my Toronto hospital, where there's 20 acute beds, sometimes 18 of them will be filled with admitted patients. And it's like having a 2-bed emergency department in downtown Toronto. You would never build that system. And so the downstream consequences are huge. And this is a great example of how funding the care is not enough. We need our government to actually coordinate the care, because it makes no sense to spend money in this way. But if we provide the right care in the right place for the right patient, we'll provide better quality care, we'll provide more efficient care, and it will save us money.
40% of the patients, Cathryn, in hospital are on a wait list. ALC patients in hospital are on a wait list for long-term care. And in a move to free up these beds, the Ontario government passed Bill 7, which essentially permits them to move patients out of these beds and into a home not of their choosing. Would you agree with this bill? What was sort of your reaction to it?
I'm not happy with the bill, no. As someone that has had family in long-term care, I couldn't imagine my mother being 300 kilometers away from me, because that's where she would have to go if they actually follow through with this. And as far as for nursing, we're now going to be forced into pushing families into agreeing to this, talking to them, our care coordinators. People should have the right to agree to where they're going, to their bed, consent. And Bill 7 takes away their right to consent, and that is absolutely wrong. People that are in long-term care need their families.
I think getting back to the ALC problem, I don't think we recognize just how bad it is. There's about 7,500 ALC patients Canada-wide. So that's the equivalent. We have about 20 hospitals full of people who don't need to be in hospital. This is a huge waste of money. And it just speaks to this domino effect. If you don't get ALC patients out, you don't have people in long-term care, you don't have enough home care. All of this stuff is connected, but our system operates in silos. So again, it always comes back to this lack of connection, lack of organization, lack of administration.
Well, and then the other issue I see, and it's something that Cathryn's been talking about, which is our labor shortage. But what about the labor shortage in long-term care homes?
Absolutely. When this family doctor listens to the crisis that we're in, especially the ALC, I'm reminded we definitely need some level of privatization. This is a draconian measure. It's a desperate measure. It's a measure being done, it's actually being kind of thrusted on patients, not without their consent, without their family's consent. It's going to add burnout to physicians. It's going to add burnout to nurses who have to tell them this. And the fact of the matter is, it's making a lot of people feel very uncomfortable and very unhappy. And this is where some level of privatization may make sense. Of course, what makes the most sense is having kept them out of that situation in the first place and keeping them at home as long as possible. And from this GP's perspective, that is simply not happening.
It does feel like a missed opportunity. There was nothing mentioned about home care in this bill.
Home care, yeah, that's the problem there. As a user, actually, of the system, because I chose to keep my mother at home with me for 8 years, the home care system is a private system, but lacks staff also. And they have no accountability. So, and especially if they don't have a family member to take care of them, they don't always even get their visits. An elderly person could be left in bed all day, no food, no water, no medication, because there was no commitment from home care to go to that patient's home. So unless you have a family member policing it, it's a very scary situation to put a loved one in.
I have to cut you off because that's it for time for this segment, but we'll be right back. Don't go away.